Live from the heart of New York City, it's The Morning Show with Mike and Juliet.
All right, for many battered women who escape abusive relationships, the face they see when they look in the mirror is a grim reminder of the hell they survived.
Yeah, but now a new program is restoring these brave women, well, restoring the face that they had before the abuse started.
I normally don't have my hair off my face, but I wanted people to see just how badly it is.
Cutting across Robin Lawton's face is a sinister scar. The end result, she says, of being abused by a former boyfriend.
The wrist was broken. I was thrown into a coffee table backwards, my back almost broken.
After trying to leave him, the 43-year-old was viciously attacked in her home, thrown out the window.
I had hit the ground so hard and the glass went right through my neck and into my mouth, and my nose was over here.
For 10 years, Robin coped with the scars, among the 75% of abuse victims suffering from damage to the face and neck. The problem is so bad, one organization called Face to Face exists solely to connect volunteer plastic surgeons with abuse victims. However, Robin was lucky to get help from Beverly Hills plastic surgeon Dr. Renato Calabria, who volunteered to fix her face.
She has had really a lot of things, bad things happen to her, and I want to try to help her out as much as I could. See, the scar is almost disappeared already.
Robin's surgery takes under 3 hours, and just 7 days later, the scars are nearly invisible.
We never fully recover. However, today I stand with self-assurance and worthiness and respect for myself.
Oh, man. In a moment, we're going to meet a woman whose nose was literally crushed by an abusive boyfriend. But first, the man who gave this victim her face back, Dr. Andrew Jacono, is back with us. Hello, Doc. So tell us a little bit more about this face-to-face program. It's not just repairing the physical scars, it's also repairing self-esteem.
Self-esteem and getting women out of these relationships. Face-to-Face is a partnership between the American Academy of Facial Plastic and Reconstructive Surgeons, which is the physical part of things, and the National Coalition Against Domestic Violence. And the goal here, obviously, is to help women get out of the relationships to start so that they don't suffer the abuse, and then once they're out of the relationships, then to restore their self-esteem and their physical appearance.
And the starting process, not healing the inside, is to heal the outside, the face. So she doesn't look in the mirror and remind herself of that abusive relationship. Like Melissa, you helped Melissa remarkably. 17 years of abuse in that relationship with the father of her 2 children.
Yeah, and this is the kind of stories we hear over and over again. You know, I first came to be involved with Face to Face because of a very tragic story. It was a woman that about 9 years ago came to me with a crooked nose, who wanted to get her nose fixed, and I assumed that she had a car accident. She said that she got hurt. And the bottom line was is that we did the surgery, everything went very well, and then literally 2 months afterwards...
Another car accident?
Well, she's told me the truth. Right. She said, you know, this is what's really going on, and I knew that there was a better way to take care of this, not her physical parts, but all the parts.
17 years, Melissa being beaten on, her nose crushed, her eyelids sagging. What was the damage?
Well, the damage is complete destruction of the skeleton. Repeated crushing and crushing of bone over and over again. Over 17 years doesn't leave much behind.
She had no support in her nose?
Yeah, all the bone's gone, the cartilage is shattered.
What was up with her eyelids? They were drooping?
Yeah, what happens is the tendons which hold the eyelids back and keep them up normally get completely destroyed and weakened so that they sag. Her eyes look like those of a 70-year-old, not a 40-year-old woman.
When we get her out here, you can maybe describe more in detail what you did and how you did it, okay?
Absolutely.
So this is after your beautiful work. Let's look at Melissa now. Hi, Melissa, come on out.
Come on out.
Oh, man. Hi, Melissa.
Hi.
Have a seat.
So, Melissa, before you look fantastic.
Yeah, good job.
17 years though of abuse. To go and get be part of this program, you have to have a year out of this relationship or out of the unhealthy relationship. Why is that?
Well, for those reasons I was telling you about that other woman, you know, we invest all this time and energy and the recovery and the healing and the anesthesia, and then to just go back into that situation where you're going to go right back to where you started, obviously doesn't help anybody.
Melissa, why do you think face-to-face this program works so well? Was it the idea of looking in the mirror every day?
Yes, of the constant reminder, and that helps you move on with the healing process as well.
Before you had the surgery, how did you feel when you were looking in the mirror?
Well, it was just a constant reminder of, you know, the abuse, and it was harder to move on.
We could do a couple of hours on why you would stay in that relationship and all that. That's the stuff you're going to have to heal on the inside of your head and your heart and your soul.
Absolutely.
But this is, you got rid of the physical reminders here. So, doctor, what did you do? Her nose crushed.
Yeah, so, you know, it's the type of procedure where you have to borrow from Peter to pay Paul. So we have bone that's lost, we have cartilage that's lost, and then we have tendons that are not weakened and not strong anymore. So for her, we had to do a very complex surgery, and the time was donated by the North Shore University Hospital, and we had to borrow bone from her skull, which is a complicated surgery because obviously when you're removing bone from the skull, the brain is at risk. And we do this all the time so nothing bad ever happens. So we take bone from the skull to rebuild the bridge. We use cartilage from the ears to rebuild the tip of the nose. And then after that, we also use some of that cartilage to rebuild the tendons of the lower eyelids and then tighten the lower eyelid tendons so that they don't droop down on the face, which causes functional problems as well as cosmetic problems.
Melissa, how are you doing now?
Good, very good.
What do you think when you see yourself in the mirror now?
Very good, happy.
Happy? Yeah. Look at you there on TV. You're beautiful, Melissa.
Well, you know what's amazing about Melissa is, you know, this is a woman who's so courageous. She turned her whole life around on a dime. And it's not just about the physical appearance. You know, she left, she has a safe environment for her children. She went back to school. She has a job now. She has her life.
Yeah.
And I gotta tell you.
Great program, doctor.
I gotta tell you, Melissa's here today, and you know, we talked about this because she wants everybody in America to know that you don't need to live with this. You can make it all turn around, and it's so important.
And you're getting help, right?
Right.
Yeah, to figure out what this is all.
From the National Coalition Against Domestic Violence.
Yeah.
Doctor, good job. Very good job. Great program.
This is why we love doing this show.
Yeah.
So if you want more information about the face-to-face program, you simply log on to our website. We hook up with the face-to-face.
EmmaJShow.com. Thank you, guys. Thank you. Good luck. All right, stick around. You got to stick around for this.